I'm now excited to turn to Ms. Rebecca Atanafu, who is the Associate Director of the Bunting Neighborhood Leadership Program at Johns Hopkins Urban Health Institute. She's also a faculty member at Johns Hopkins School of Medicine, an affiliated faculty member of the Bloomberg American Health Initiative, and the founder and CEO of R&D Associates Global to facilitate our next panel conversation. Ms. Atanafu, may I turn to you to do a much better job of introducing yourself and then welcoming our panelists for our conversation across generations.
Thank you so much, Ivory, and I am delighted to be here with you with National Academy of Medicine and Robert Wood Johnson Foundation. Absolutely fantastic panel presentation is prepared ahead of you, following awesome framework that was presented by our keynoters that just ended. So my name is Rebecca Atanafu, and I am a faculty member at Johns Hopkins School of Medicine, engaged in community research work around cancer and smoking. I'm also Associate Director for the Bunting Neighborhood Leadership Program within Johns Hopkins School of Public Health at the Urban Health Institute, and also the CEO and founder of R&D Associates. I have amazing panel prepared, and I'm going to do an introduction, but before we start the panel discussion, I want to share some ground rules that our panelists came up with, and we've chosen 4, and that's respect for each other's opinion and allow others the opportunity to share and make space to unlearn, learn, and unlearn and learn. So it's learning is a continuous process. And one other thing that I want to add is that when your time is up, I'm going to just wave my little sticky note for the panelists to say it's time to move on to the next person or the next question. Since we're a really racially and ethnically, linguistically diverse panel that we have here, and since language is so important in this discussion, let's just begin by saying hello and your name. And the hello, it could be in your language. So I will model that, and my name is Rukka, and salam, which means hello and peace, in Amharic, my native language from Ethiopia. So I will turn to our panelists to introduce themselves. And first on the screen that I see is Rashad. So Rashad, briefly, in 1 minute or less, introduce yourself.
Peace and blessings, everyone. Thank you for the opportunity to be amongst all these great thought leaders and practitioners. I am Rashad Staten. I am the Youth Engagement Specialist for Baltimore City Public Schools, as well as a social entrepreneur in Baltimore, Maryland, and a community change agent. And in Baltimore, we say, what's up? So,
all right, what's up? Okay, great. And I see next, David Garcia.
Let me unmute. Hello, everyone. Greetings. Thank you for having me today. I'm Dr. David Garcia, and I am the Director of Quality Improvement at the Texas Center for Infectious Disease. I am a behavioral scientist. I do a lot of research in social determinants of health, primarily trying to understand how they perpetuate racial, ethnic health disparities and sexual health disparities. Thank you for having me today. I'm also a lead scholar, like the 2 presenters prior, Tracy. And so thank you and have a great day.
Okay, the language of hello you want to use?
Oh, buongiorno, hello, hola, all of them. I love them all.
All right, thank you, Dr. Garcia. So Karina Lopez Zamora.
Good afternoon or good evening, good morning, wherever you are. My name is Karina Lopez Zamora. I am a computer engineering major at Johns Hopkins University. I am a first-generation college student, so I'm very excited to be here to learn about health equity, especially in communities that are underrepresented. And I'm originally from Mexico, so I would say hola.
Hola. Okay, thank you. And Benjamin Yawaki.
Buju Anin, that's our Anishinaabe Moan way of saying hello. Toko e Wanka Hokshila Nindijinakas, Ashiwi Dash Meganak Waju Inanawag Ndunjaba. And so what I just said was, hello, my relatives. My name is Sees Enemy Tracks. My English name is Benjamin Uwaki, but I'm a descendant both from the Pueblo of Zuni as well as the Turtle Mountain Band of Chippewa. And I'm a current graduate student at the University of Minnesota's School of Public Health, as well as our Free School of Public Affairs.
Okay, thank you. And Monique Brown.
Hello, my name is Monique Elwood Brown. I am the program manager for the Healthy Neighborhoods Project, which is a research project based at Tulane University here in New Orleans. I am also an Atlantic Fellow for Health Equity based out of George Washington University in Washington, D.C. And down here in New Orleans, how we greet everyone is, hey, y'all.
Wonderful. Okay, thank you for that. So I'm going to start with you, Monique, and tell us a little bit about what does the future of community engagement look like? Are there innovative approaches that seasoned professionals should consider reaching those that are not at the table? You know, reflect back on some of the presentation from the speakers prior and add on to your experience also. Monique, are you with us?
I am so sorry. Yes, apologies again.
Mm-hmm.
I think what the future of community engagement looks like is, you know, in some ways, this past year or these past 9 months, we've kind of seen it a little bit. Because of COVID, we've moved into sort of this virtual forms of community engagement. My project in particular is doing focus groups via Zoom, and you know, I participated in a neighborhood engagement summit that was also done via Zoom. And so I think that may be sort of the way that we're headed. I'm also seeing more participation from my community advisory board now that we are virtual and versus when we were safely able to meet in person. I do understand that this way does have its challenges. Not everyone can meet virtually. There are some folks who, you know, don't have access to what's needed to meet virtually, or, you know, don't have access to Wi-Fi. There's also a lack of human connection or that one-on-one interaction that can present a challenge by meeting with Zoom. But for a lot of folks, it's an ability to reach more people. I would say one key is to try to keep it engaging. I have participated in community engagement sessions and meetings that have had DJs and music and painting by numbers and, you know, just different ways to keep folks engaged. Community engagement is less about work and more about relationships, how you connect with people.
Okay. All right, great. I mean, Rashad, I'm going to call on you. You heard of the presentation about that. It is not about imposing power, but about sharing power. That is what we need to talk about when we do community engagement. So tell us a little bit about your experience related to that, and how has the Bunting Neighborhood Leadership Program helped you to be an instrument of setting a space for people to share power, including you, and to provide space for people to be at the table. And that's whether young people or people of color. how have you been able to do that, and how have you benefited from the your fellowship experience with the Bunting Neighborhood Leadership Program?
Oh, most certainly. Thank you, Repka. I think, one, I want to step back and say I am a proud graduate of the Johns Hopkins Bunting Neighborhood Leadership Program of 2018. And I must say that that point in my life, that Bunting was a transitional space for me, both personally and professionally. At that time, I was aging out of the, I want to say, the timeline or the time frame of where you categorize an actual youth. And I was transitioning to an adult professional, but also with years as a youth leader on the ground working in the communities, as a youth leader and what I called myself at the time a system agitator. And what BNLP offered to me was this aerial view of the same work that I was doing, but from a different lens. Bunting Neighborhood Leadership taught me how to approach the work from a systemic level, of understanding how data can drive impact and outcomes, but also through our facilitators and the thought leaders that build our capacity. They really installed in myself and my other fellow peers were the fact of maintaining intentionality between the humanity of the populations and communities that we wanted to serve. The BNLP and Johns Hopkins gave me a sense of looking at the work, which I call community work and heart work, through a lens of public health. Right? I never knew what public health was through my younger years, but once I was a part of BNLP and the fellowship program, I started to see how everything has a direct connotation to health outcomes, health trajectories, and us living fruitful and successful lives. And that's one thing that it did. It allowed me to look at it in a more of a holistic approach, and knowing how to use transferable language to enact emotion from other adult professionals that wouldn't actually have the accessibility into the communities that they studied for years on. So I came to BNLP with some lived experience, but I acquired some high-end professional and academic lenses that I didn't have prior to it. And as I was connected and going through that, one in particular was I was working, BNLP taught me how to change Bunting Neighborhood Leadership Program taught me how to shift and advocate for policy reform and resolutions through a public health lens. One in particular, working with a community-based organization that is focused on young people in Baltimore. Baltimore, if everyone doesn't know, is the dirt bike capital, in which our young people and those around Black and brown populations actually engage in dirt bike activity, but on our urban streets. And it has led to criminalization and the further parts of that. And it taught me how to look at this with an equitable framework to compare it to other spaces and opportunities that were offered to other ethnicities and races, i.e. skateboarding, or the scooters and shared riding, to connect that to dirt biking. And we started to shift programs, fundings, and other allocations to complement that. And I've now do it with a lens, so that was perfect. Thank you for it.
Great. Thank you so much, Rashad, for that information. And so Dr. Garcia, so you're a director of quality improvement and research. So in your experience and where you sit as Texas Department of State, how do you promote health equity in communities and help ensure that there are opportunities for diverse groups to be represented in the decision-making process at community level, but at the state level? And how do you do quality improvement and do community quality assessment that is being applied in your effort in Texas around addressing community health equity?
Thank you for that. I think, yeah, that's a very important question. I think, for me, data is important. I think that when we're designing tools, that community has to be engaged in informing what those tools are about. One thing that always sticks out to me that was a lesson to learn was that not all Spanish is the same and does not speak to all communities that speak Spanish. It varies by country of origin. And there was a survey that we had done and a prior job that I had where we were doing them in Miami, Texas, all over. And Texas is primarily more Mexican, but New York, more Dominican, Puerto Rican, and the Spanish truly varies. And our problem was that we had engagement with Puerto Rican, Dominican, but we hadn't yet tapped in the Mexican. So we took the survey down to them and they said, hey, what's this? This doesn't sound right. This doesn't sound the same. Who created the survey? So I think that is important, right? That your tools, in order for them to be culturally relevant and responsive to all communities. And I think that we're learning that more about Latinos, is that we're not all the same. We're not all cut from the same set of scissors. We're all very different. I think speaking more about data for Latinos, country of origin then is important to track in your surveys to be able to see what kind of disparities exist. And in terms of equity, we need to know oftentimes we see that Cubans are faring better, right? But if we don't have that data, if we're not tracking whether they're Cuban or Mexican or Dominican or from what country their family is from or where they are from, then that is important. I think even further thinking about whether they are first generation, second generation immigrants, but thinking about a way that you can ask that question without the stigma of immigration, because this administration now has people scared about saying they're undocumented, but really framing it in a way where with community engagement about how are you willing to share with us whether you are undocumented or not? What is the language you want on the survey? I feel like those are some key points.
That's definitely a good segue to Karina. So I'm gonna call on you, so as the Latinx here. So how can, Dr. Garcia, ended by talking about one, that there's huge diversity in the Latino population. And he talked also about, towards the end, about DACA and representation of DACA at the table as we make decisions. So how can you support first generation, how can we support first generation Latinx and other minority college students from pipeline to college graduation? And you're an example. So speak about your experience as lessons for us to actually apply in our work.
Thank you. Yes, I'm talking from experience. I think the best way to support and help out Latinx or other minority groups is starting from the very bottom. And I think high school level is a very critical point in a student's life, because they're teenagers, they want to explore different things, they want to get to know themselves. And so helping them and bringing that support to their lives is very critical. If they don't find that support at schools and their families, with their friends, then of course, whatever direction that they take in their lives is going to be very different. And sometimes we see that it's not the best decision, right? Whether you go to school or whether you do another thing, but not having that support from your educational system is it can harm the student. As a first generation college student, I believe that supporting community organizations is a key when trying to promote and encourage Latinos or other minority groups to pursue higher education, because in my case, for example, my parents are not very familiar with the process of going to school. Sometimes they don't know what an SAT is, what a GPA is. And so you can't really seek the help within your family because they don't know it. And so having community organizations that help that help students pursue higher education is very important. And now that we have a new opportunity for DACA applicants, it's more important because we have more opportunities. There are more students who can get more opportunities if they apply to DACA. They can get a job, they can go to school. They don't necessarily have to pay out-of-state tuition, and it's just it will be very important for that.
So what was the support that helped you along the way? So you didn't have the support of your parents because they did not know how to navigate the system or how to help you. So where did you get the help that you need to be the first generation college student?
Within the school, I had a few teachers who helped me throughout the way. not my counselors, not the people who were responsible or who were in charge of that. They were my teachers, because I made that connection with them throughout my years in high school. They helped me because I sought help. I wanted to go to college. I desired to go to college. I wanted to be the first one in my family to go to college. And so that motivation really helped me be where I am today. But after graduating from high school, I went to a community college, and there I found the support in a scholarship that I was part of. It's called Granville T. Woods. And it's not just a typical scholarship, it's more about a family. Of course, they pay for your tuition, for fees, for books even, and they even gives you a laptop. But the most important thing that I think is the support that they give you. They're not just supporting you in your education, but also as a person. Sometimes, I mean, life is weird. We have our ups and downs, and we need that more support, and of course, educational support too, which is what I found.
That's great. Your perseverance and identifying key stakeholders that were invested in your education, the teachers, and they were your support. And so you had the leadership skills to pursue that. So Benjamin, I'm turning to you. You're working on the development of Tribal Leadership Handbook. So please share with us what that handbook is about, and how that you see that being applied in terms of a better understanding and working with tribal communities.
Yeah, I feel like when we think about, you know, especially now with COVID happening, we think about like the public health structure as it exists. A lot of it is very much like state and county based. And there's not too much that has to do with respect to like incorporating indigenous communities, tribal communities in that thought process. So really, when it comes to developing out this handbook, is this desire to understand that tribal public health has the capacity to do a lot of the things that are being done on the state level. And I feel like that hasn't necessarily been brought to the forefront of the conversations that we're having, particularly around like COVID-19. And so that's kind of, you know, where my mindset is at. And a lot of that comes down to the basis of whether it be state, county, municipal entities that don't understand tribal sovereignty and what that means and how that exists within the context of providing for a lot of these public health emergency declarations that are being advocated for. And so I don't know if many people are interested or understand like what's coming out of like South Dakota. That provides a pretty unique case study with respect to what their governor has decided to do with a lack of declaration for any type of COVID-19 preventative measures. But you have an instance where tribal sovereignty is exercised in reservations like Pine Ridge and Cheyenne Sioux Reservation, where they are mandating checkpoints. And these are examples of tribal public health exercising themselves in ways that they have never done before. And these are providing, like, these are real, like, in like real-time examples of ways that tribes have never exercised their public health sovereignty before. And when it comes to developing out this toolkit, is we're trying to learn from these examples. Like I said, these are different ways that have never been done before. And we're trying to utilize them in a way, especially when they're being confronted by challenges in the Supreme Court, is that we're utilizing the opinions that are coming out of there to help really define what this public health looks like, what this public health response looks like, and how we can do it in a responsible way.
Okay, great. We have a question. Do you think DACA children in some states are more disadvantaged than in big states and cities? Also, does socioeconomic status matter? Anybody can answer, it's for anyone who would like to answer.
Well, I can speak DACA aspect, but especially from the socioeconomic and the social determinants of health aspect, yes, definitely. We look at how tribes have been, there's been a lack of advocacy, not only at the federal level, but the state level, that has left us severely negatively impacted, not only by COVID-19, but by congressional failures for when we talk about appropriations of funding for Indian Health Service. There's a long litany of history of lack of funding, not only for Indigenous communities, but I'm sure everyone else can speak towards African-American communities, Latinx communities, and even like as you know, developing the conversation about how we talk about protecting LGBTQX communities, especially in the public health sphere.
So diversity, equity, and inclusion, or DEI, has become such a national buzz phrase, particularly in last year. And many businesses and organizations are promoting DEI. How do you go beyond the hype and truly create measurable process and outcomes and accountability system so that it's really authentic DEI and not just companies or organizations or states promoting diversity? Anybody? Wow.
I'll take a stab at it.
Okay.
City schools in Baltimore City, we have our Department of Equity office that's been operating for the last 2 to 3 years now. And we've started to build a capacity of actually building the capacity of school leaders and principals and administrators, while simultaneously we're building a youth engagement strategy to engage our populations that are not as active. We're noticing a gap from activation and student involvement from middle and high school. But I think that all connects to and the disparity gap between equitable lenses and our approaches to young people. So as we create this equitable framework as well, what we've done based off of my own professional development myself is correlate the equitable framework of DIE to advancing youth development and supervising youth development certifications trainings, because I believe that the equitable framework puts terminology, language, and a lens to the work. But what we've done when engaging our young people, Black and Brown population students, we use this advanced youth development framework to build the capacity of thought partners, educators, and everyone else to remind them of sensitivity, to remind them of brain development, to remind them of a cultural relativity, and actually the offerings that are given or shared through programs and other spaces in and out of school. And what we've learned was that a lot of the ways that we go around our pedagogy is not relatable or transferable to the students that we want to impact the most. So a lot of the work that we're doing to impact an equitable framework is changing language, right? Is first teaching the adults prior to us inviting youth space and prior to us allowing young people to share a space that creates a space of youth and adult partnerships, to offer that same capacity building and professional development that we would give to adult professionals to young people. And we're currently in a pilot program as well, where we have, based off of my learned processes from Bunting Neighborhood Leadership Program, we created this new initiative at City Schools, which is actually a youth fellowship program being housed out of our educational agency. And we're offering these same equitable frameworks, continuous improvement goals and efforts, and giving them the same opportunities in the same work group and facilitation sessions as we would do our adults. And we're seeing immediate impact that that is showing up and showing tangible results even within the first month. And we're starting to see our young people more equipped and have a sense of self-confidence and identity to redirect conversation to make sure that they are included at the beginning and throughout the entire process.
Okay, great. Thank you. In the work that we do on colorectal cancer and smoking prevention, we work very closely, by we I'm talking about Hopkins, very closely with community representatives, so community advisory groups, and try to be really have a shared ownership of change that we would like to see in our communities. So when you work in community engagement, what are some important key principles for that shared partnership with community? And Monique, how have you done that in the work that you've been doing around tobacco-free schools, tobacco-free colleges?
Need a moment to think about that. I just want to flag a 10-minute time warning. So Monique just wanted to jump where you got started.
Thank you, Ivory.
Sure. So I was with Tobacco Free Living some time ago. Actually, it was about 10 years ago. Worked with the Tobacco Free Living program, but within that program and with my current work, what I find is honoring community voice actually is crucial, that we honor the lived experience, that we allow them to share their stories. Their stories are so important to them, but it's also just as important to the work itself. So now I'm in research. I'm in a research project here at Tulane University. And what we're finding is that the quantitative data, those numbers, that the percentages or whatever, play a big part in funding and whatnot, but we want to stretch it to where more of the qualitative piece, more of the community sharing, their voice and their experiences can also have a major impact on the work itself. And we also take it as far as compensating them for their experience. Community is consultants in the work, and consultants get paid. Some of them get paid rather handsomely for their experience and how they can move a project forward. And so we do our absolute best to do the same with our community members who are part of this project.
Okay, great. Thank you. So it is a partnership, and academia and funders and community-based organizations need to work together in terms of be receptive and sharing power and influencing each other. And if someone, one or two more people can just chime in and share from their experience, key principles to take into consideration and working with communities and in a very authentic way. One of the things that we've done in Baltimore actually is through Baltimore City Health Department is working with barbers and beauticians and faith-based organizations to promote sexual health with funding from Baltimore City Health Department. So it is really reaching people where people are at. So really going outside of our comfort zone or our academia or wherever we sit and being out there engaging with communities and those that are in every street corner, those that are very well respected in their community, and engage them in the process of addressing health equity with us. So more examples of that, please, in terms of shared power and authentic engagement. Yes.
I guess I would say to really think about the importance of valuing individuals who are contributing to your engagement and thinking about what they want or how they want to be valued. I think also in my experience, I've learned that respect is key, and to always be respectful and think about, how you can be respectful to these communities and asking them how is respect, because I feel like respect is something that's learned and it varies from everyone. And so if you feel that you disrespected someone, you know, make sure that you apologize and that you always think about how people want to be valued and want to be respected.
Right. Karina, let me ask you a question. So you've doing a lot in terms of to give back. You've had some success, you're first gen, but you're reaching and to your community, Latinx community, and helping to immigrant community. So can you share with us what you are doing?
Yeah, of course. Recently this summer, I worked with Delegate Robin Lewis, and our mission was to really get to know the immigrant community here in Baltimore City. So we conducted a survey, and based on the question that you asked before, I think one of the most important things, especially with immigrant and underrepresented minority groups, is to bring that, to have it confidential and to let them know that it's okay to share their story, that it's going to be confidential, that their information or anything, you know, related to them is going to be spread out to other organizations, right? Most of the time in Hispanic or Latino communities, there's a fear of not participating or not getting involved in your community or with your local government is because you're afraid that somehow your information is going to get leaked into ICE or you're going to get in trouble or things like that. So I think being respectful and knowing and considering that, you know, even though we're all humans, we have a different perspective of what respect is, as somebody mentioned, of what what respect is. So I think being open-minded could be a really good way to establish that community engagement.
Can you share about the scholarship program that you
And when I was at Baltimore City Community College, it's actually the first Latino student club at BCCC. And really one of our mission was to educate people in the school about who we are as Latinos, right? Not what you hear in the media, not what your neighbors are saying, but who we really are as people. We're very caring. We're rich in culture, and so that was one of our goals for the club. Another thing that we wanted was to help undocumented or students who couldn't receive financial aid, and so we launched a scholarship that helped students who couldn't apply to financial aid to help pay for their books or anything that they needed. And so that scholarship has been very successful. A lot of our partners are in the community, of course, and they have helped this dream come true, to be honest, and really help Latinos and other minorities who pursue higher education and pursue their dreams.
Thank you. Thank you for sharing. Oh, someone speak? Okay, sorry. Okay, so we have a few more minutes to ask questions. For our, we have time, a little bit of time for discussion. So let me get to it because I have a few more questions that I could be asking. Okay, so in thinking about youth, because this is an intergenerational conversation as well, right? So Rashad or Karina, what are important lessons we need to keep in mind? And I want to add to what Rashad said, what are important lessons to keep in mind when we think about bringing different generations of people together to work together. So there are community advisory boards where young people are represented, 1 or 2 young people. That is not really authentically engaging young people. So how can we really be conscious and sharing that the power, and not putting young people in a position where there is such unequal power, and then we say, well, the young people did not participate in that advisory group, or they didn't say anything. So that is a setup. So how can we be intentional in this setting up the power, the intergenerational relationships that we can all learn from?
I think we're actually in this process, and I think Baltimore is one of the leading probably cities that are working very progressively towards this. One in particular that we do is we start off with language, right, and creating a space before it is transferred to actual persons. So when we're engaging young people to share space with adults, if that opportunity was created by an agency or institution, the first thing that we ask of the institution is determine the role of the stakeholders that are at that shared table so that we can shift power. One is to determine whether this space is youth-led, youth-focused, or youth participatory, in which it'll show up in the actual role and the impact in the space that the young person can offer. One is this, if it's youth-led, are the young people leading with the initial planning of it and throughout the actual stages, or if it's youth participatory, are you just expecting a young person to participate in the opportunity that was created for them to engage and be impacted by? And the other one was spoken of, excuse me, in the back, I'm still at grandma's house. The other part is the reality of what was lifted up by David himself. We definitely push the urgency of compensating our young people to give input. One is because we want to make sure and make known that all personnel, even communities and adults from our communities that are coming to participate in these focus groups or conversations, that your intellectual property honors compensation, right? Your lived experience is intellectual property. And most of the times these conveners or facilitators are representative of the agency, which means they are employees and getting paid to moderate these spaces, but they're asking you of your lived experience to drive outcomes. So for us to make sure that it's equal respectability, we impose that all those that are sharing space and input are fairly compensated, even to the young person. And that forces our adult professionals to see that there's equal power amongst them, and you cannot make a decision without them. We definitely live under the mantra, nothing about us without us, which is something that we lift up to ensure that there's equal shared power amongst all. And then that allows us to be very receptive. And I see this impact very soon. And now we have young people in Baltimore that won't even answer a call of support unless they're fairly compensated, because they live in a space where they know they have value to space.
Anybody want to add to that? Okay, so any questions? I'm looking at the chat. Any questions from the chat room? Am I missing anything, Ivory? No, I don't see any questions on chat. Okay, any questions, Ivory?
I don't see any for the group, so I don't know if maybe we want to offer a last statement from you all. And then I'll take it from there.
Okay. Yeah, so we can wrap up with last statement. So, so prepare your final comments as we wrap up this panel discussion. So one person said I had a question in Q&A, and that's Orlando Vela. What was that question? So while we give, oh, you see, okay, Ivory, go ahead.
Yes, thank you, Mr. Velasco. Any thoughts as to how states and tribal nations can work together to dismantle inequities when so much of the services and/or initiatives offered to these communities are at the federal level? Any examples that could be shared?
Hmm.
You may have posed a great question there.
Yes, yes. Repeat that question again for our panelists. Yeah.
Sure. Any thoughts as to how states and tribal nations can work together to dismantle inequities when so much of the services and/or initiatives offered to these communities are at the federal level? Any examples you could share? And perhaps one framing that we might think about is, although this is targeted specifically at tribal nations, perhaps there's something to consider about federal services and initiatives that may have an impact on local, state ways that we can have community serving organizations be working better, or at those levels across state and federal government. So perhaps not just about tribal nations.
Okay. Examples that people want to share. Okay, so let's come back to that question later on, and let's people respond to or prepare their comments, and maybe we will get to that question later on at the end. So we'll keep that in mind. Okay. Oh, someone commented. So comment on federal and how to impact these programs typically are expected to efficacy is enhanced by community engagements. So we need to drive this point. So stressing community engagement and having community at the table to facilitate the process, whether it's at the federal level or at the local, state and local level. It's all about providing the opportunity for people to come together, right? We have, in terms of our common values, to promote health across the board for everyone. It's a matter of who sits at the table to make the decision. So whether it's at a federal level, how do we bring it down and address it at a local level or at the state level by convening stakeholders and making decisions as to how to engage our collective force to make change happen. So hopefully that addressed a little bit your question. Okay, so yes, another question, Ivory?
No, I was just going to offer you all the opportunity to wrap up, and I'll transition us into our public statements.
Okay, all right, who would like to start the closing statement? Any of our panelists that want to start? Karina, why don't we start with you?
Sure. Well, thank you so much for having me today. It has been a pleasure to listen to the work that everyone has been doing. I really look forward to getting to know more of the panelists and see how we can bring more equity into the communities. Again, thank you so much. Have a great night.
Okay, closing remarks, Monique?
Kind of along the same, thank you so much for the conversation, for the discussion, for the learning opportunity. Is absolutely a fantastic learning opportunity. And I too look forward to getting to know the other panelists better, as well as the moderator a little bit better going forward. And I don't know if contact information is shared, but I'd be more than happy to share my contact information. If anyone has any additional questions for myself.
Okay, thank you. Dr. Garcia?
Yes, thank you, everyone. It was great to serve on this panel with all of you. You're all doing amazing work, and just wanted to echo, Rashad's sentiment about, participation is not the same as, people just being there and thinking about ways that we can shift the power to the communities that we serve, that we are truly engaging them. So thank you, everyone.
Okay, Rashad?
Yeah, I'll share my sentiments that are reflective of the other panelists as well. Grateful for the opportunity to learn and also share the work that we are all doing in our respective fields and lanes, and as well just lift up the notation of what I've learned is as we all do our work respectively, that we share some of the best practices and learnings that we gain from it, because we are all serving some population that is either underrepresented or under-supported, which is visibility of inequities. However, if we share these, I think it can be transferable to other sectors and other demographics. So as I continue to build the work around youth engagement, please continue to loop me into with the works and the strategies of our Latinx and immigrant populations, as well as our tribals, because I've learned them as well, and I've used them around the youth engagement work. But I can see we got much work to do, but I'm hopeful and I maintain faith that we'll all get to that place. Thank you again.
Okay, thank you. Some of the so in summary, some of the key things that I heard from this panel conversation is that respect is absolutely paramount, is really essential in terms of how you approach your work, working with community and establishing that partnership. And that relationship is very important. We're human beings and we value that, and we need to build trust with each other. We need to be intentional, because partnership does not happen in a vacuum. We have to make intentional effort to partner, and we also need to acknowledge the importance, the important force that that is based on shared decision making. And be willing to step out of our comfort zone so that we step in, step out, and reach out to people that we're not familiar with, communities that we are not familiar with, to work together and document our success is something that I also want to say is very, very important. And that's the process and the outcome, so that we can collectively learn from it and build on it. So thank you very much for my panelists. It's a great pleasure to have this time with you. And thank you, Ivory, for inviting all of us. And I turn things back to you.
Thank you, Ms. Atanafu, and thank you to each of our panelists for joining us this evening and for engaging in this conversation to help us to think about and explore ways that we can continue to elevate opportunities to use community knowledge, strengths, and resilience to inform our way forward. I think as we've tried our best to navigate how to have this conversation over Zoom in a virtual world, I think this panel went very well, so I applaud you, and I hope there are others in their living rooms in their kitchens applauding you as well.